Hi, my name's Michelle Gellis, and today I am going to be doing a microneedling self-care for acupuncturists. So the first thing you want to do whenever you do any microneedling is make sure your face is clean. I've already washed my face, but I like to go over it with makeup remover wipe, and I spray it with a little isopropyl alcohol. And you want to make sure that any area that you are going to be microneedling has been wiped with alcohol so that it's clean. And then you want to take a tongue depressor and and your hands should be clean. When you're working on a patient, you should always have gloves on. When I'm working on myself, I don't, but I do wash my hands. And I put some numbing cream on. This is Uber Numb. You can get it on Amazon. And so I am mainly going to be working on my mouth area and chin, like this. I'm also going to be working on my nose, hopefully getting rid of some of those large pores. And I am not going to be doing my neck because I just did it recently, and I just did the rest of my face recently. But I am going to do my chest, so I'm going to work on that. Okay. So the areas that I'm going to nano needle, I am not going to be putting any numbing cream. You really don't need to. So you would leave the numbing cream on for 10 minutes. And so while the numbing cream's on, I'm going to explain how the pen works. So this is an Aculift micro pen, and you'll know it is a genuine Aculift brand when you see the Aculift logo. And when you get your pen, it comes with nano needle cartridges, and it also comes with microneedle cartridges. So you want to familiarize yourself with which is which. And I'm going to start out today with the microneedle cartridges. So these are 16-pin microneedle cartridges. Actually, I'm going to start out with the nano needles because I'm going to do nano needling on certain parts of my face, and then I'm going to do the microneedling on other parts. So actually, I'm going to put a little numbing cream on my forehead because I am going to do some microneedling on my forehead. And so what you do is you take your microneedle cartridge. You're going to need a scissor to open the packet, and then you take the microneedle cartridge out and you put it in the pen, and you make sure you feel it kind of click in, and then you take the little white cap off. And you have two choices. You can either use the battery that is on the end, or if you want, you can use the option for the corded end, which is this small end, and you could screw that on and you can plug it in. When I work on myself, I tend to just plug it in. When I work on patients, I use the battery. But either way, I'm going to show you what that looks like. And so this is power 1 and power 2, 3, 4, 5, and 6. And these are different speeds, and this controls how fast the needles move in and out. I tend to work around power 5 or 6 when I'm on my face, and I work quickly. when you're first starting out, you might want to start out at 3 or 4 until you really get used to the pen and how it feels and just comfortable with the pen in your hand. And the other thing that I have bought on Amazon, which I love, I don't sell these, but is a little stand for your, whoops, a little stand for your pen. And that way when you put it down and you're doing different things, the pen doesn't roll onto the floor. So that's handy to have. And then the other thing that I get are these little sleeves. Again, you get them on Amazon, and they are called microneedle pen sleeves or tattoo pen sleeves. And these are great because your hands tend to get serum and stuff on them, and you don't want to get it all over your pen. So you can buy these and you just slip it right over the pen, and then you put your cartridge in, and it also helps prevent any thing from getting into the pen, which is nice as well. So the other thing I didn't talk about was the needle length. So there's you can see the little arrow here, and you're going to start out putting it at 0, and then for different areas of your face you're going to go to different depths. So areas on your face where you have thicker skin, your forehead, your nose, your chin, you would use, depending on your skin type, and there's a chart that will be on the handouts that accompany this, but you can start depending on how thick your skin is, how old you are, how fair your skin is. People who are older, have lighter skin, tend to have thinner skin. People who are younger and have darker skin, or have darker skin, tend to have thicker skin. So if you're somewhere in between, you have medium skin, and it's not terribly sensitive or thin, you can start out at a 0.5, maybe even a 0.75 on the areas where your skin is thicker, and then where your skin is thinner, around the eye area, on your cheeks, you would, and especially on your chest, you might want to put it at a 0.25 or a 0.5. And the goal when you're working with the pen is, as you're making your passes back and forth with the pen, for your skin to get pink, not necessarily bright red. It can happen, but with 1 or 2 passes, 3 passes, it should just be pink. If it isn't, you move on to another area and wait, because sometimes your skin will pink up while you're working on a different area. And if your skin, it starts to bleed, then you're going too deep. Some pinpoint bleeding is okay, but your whole face should not be bleeding. And some individuals will get very red the first time, and it's okay. Usually by the next day, all that redness is gone. So I'm going to go ahead, I'm going to put the needle cartridge, sorry, I'm going to put this on for my pen. I'm going to start out on my forehead at a 0.5, and then I am going to put this needle cartridge on, and then I'm going to set my pen down. I'm going to take my makeup remover wipe again, spray it with a little more alcohol, and take this numbing cream off. I'm going to leave it on my chest since I'm going to do that last. Just like this, so you get all the numbing cream off. And then I'm going to have to keep my glasses off, so I won't be able to see very well. I usually do a combination of serums when I work on my skin. I will use the Superb serum. I have a large bottle of serum. This is the Superb serum. But normally they come in bottles about this size. And before I forget, the numbing cream should stay on, depending on you, anywhere from 15 minutes to a half an hour. It depends on how sensitive you are. For me, I usually leave it on for about 15 minutes. So with the serum, this serum is vitamin C, hyaluronic acid, and collagen all mixed together. And I like to put this on along with either Nourish, which is a peptide serum, or the Revive, which has a lot of vitamins in it. Today I'm going to be working with the Nourish serum. So I mix the two of these together. And then I will just put it on a small area because it gets absorbed very quickly. And then I will put my pen on, and I'm going to be at, I think I'm going to go to power level 5. So it's a power level 5. And then what you want to do, so you're going to work in a small area, and you're just going to go left to right, and you don't have to press very hard, okay? And then you're going to go up and down, and I think I'm just going to work on one side of my face right now, and that way you guys will get a demo. It's important that you work around the perimeter of your face, okay? Because you want to build the collagen up around the perimeter. It's important. And if the pen is not gliding smoothly, then you need to put more serum on. So as you can see, I'm a little pink already, which is good because that is the clinical endpoint. Now, if I had any wrinkles, what you want to do is spread them, and you would use the pen kind of up and down on the wrinkles themselves. So like in between my eyes, I am going to spread and work right on those 11s. Make sure I get them just like that. And next I'm going to skip my cheeks. Like I said, I recently had done some needling there, so I'm just going to nano needle there. And I'm going to I'm going to work on my nose. So I always like going from the top down. So I'm going to put some serum on my nose. And this is great for large pores. I'm going to do my whole nose because I really want to get in there. So for my nose, I'm going to turn it up just a little bit because the skin is thicker, and really kind of just get in there, work on those large pores. So you can work in little circles to kind of, it's like scrubbing, right? It's more of a scrubbing motion. And so when I'm working in small areas like here and around my lips, I will do more of a scrubbing motion. Okay? So now I am going to work around my lip area. I think I'll do my whole lip area as well. And you can see my nose got a little pink too, and that's perfect. Because what will happen is over time it'll pink up just a little more. So, and you can adjust as needed with your pen. I'm going to go over my nose just a little more. So the faster the pen is going, the higher the speed, the more times the needles are going in and out. So you could work a little more quickly you want to go about 1 inch per second when you're moving. So just kind of like this. Go up and down, left to right. And again, this is great if you have large pores, wrinkles, those fine lines around the lips. You know, a lot of people are getting like filler in their lips and Botox in their lips, but this can take care of those lip wrinkles without having to do any injectables. I have a wrinkle right here. I'm just gonna just like that. Get up and down. Okay. And the other thing I'm gonna do is I am gonna work just a little bit around my perimeter, and then I'm gonna just get in here just to make sure. You always want to get the perimeter of your face. Really build that up. And then you're going to switch out. I am going to switch out and just do the nano needling on my cheeks. Now normally I would be doing needling. I just keep repeating myself so you guys understand. But I just did some needling on my cheek last week. So the nano needles, I don't know if you can see them. They're itty bitty and you can just hardly see them. But you can do nano needling like every other day on your face. So the nano needling I'll do inside the orbital rim on the red part of my lips. So I'm just going to put some serum there. And there's no downtime at all. So you just kind of get right inside here. Really work inside. You can go all the way around inside your eyebrow. I'm going to use it on my cheek just as a really nice exfoliation. Just like that. You really shouldn't have any redness at all. Okay? And then the red part of your lips. It's fabulous. Really helps to get rid of that dry skin and plump them up. It's really nice before you put your lipstick on. Nice exfoliating. It's fast and easy. And again, when you're done, you always want to put these in your sharps container. You shouldn't be reusing your needle cartridges, even though you're using them on yourself. Okay, now on to my chest. I'm going to put my glasses on so I can see what I'm doing here. So I am going to, whenever I work on my chest, I always dial it down because the skin here is very sensitive. So I'm going to use my makeup remover wipe, and this is great for all that like dark skin and sun damage that we get on our chests over time. So I'm going to put some of the Superb serum and then a little bit of the Nourish. And you know what? I'm even going to mix in some of the Revive because this has CoQ10 and DMAE and vitamins E and all different wonderful vitamins, including vitamin A. So I really want to give my chest a really nice treatment. So I have the pen. I have the pen for myself on 0.25. You might be able to go to 0.5. Now when you're working on your chest, I like to go all the way across, and you really don't have to press too hard. and I go left to right, then I'm going to go up and down, just like this. And this is amazing for those dark spots. So if you have any really large dark spots, I used to have one here, it's pretty much gone, but I have a pore right here, so I'm going to dab at it. If you have any like clogged pores or dark spots, here's a little spot right here, you just stab at them and they might bleed a little bit, and it's okay. You just want to make sure when you're done that you don't do anything, you don't touch your skin or anything. You're just going to use some of the calm, which is aloe and arnica. So I'm just going up and down. You see how I'm moving about 1 inch per second, very little pressure, very light pressure. That's it. That's all you have to do. Now if I was going to do my neck, I would work up and down on the other side, and then underneath my chin, and this can help with those lines. So maybe I'll just do a little nano needling on that area, just to really get a good exfoliation for today, and make sure lots of serum, because your skin will eat this up, or drink it up, I guess. So underneath, just like that, and so this is just the nano needle, so you notice I'm not getting very red, but it really helps to infuse the serum in, which is nice. So, and that's it. So again, when I'm not very pink right now, I might go back and go a little deeper, do another pass, and certainly I would work on the other side of my face. But this is pretty much what you need to do. When you're all done, take some of the calm aftercare, and feels so good, and smells good too. Here, I have a friend here watching. It's very nice. So this helps with all that redness. You can see my chest is pretty red. I did a few passes on it. So any areas where you microneedle, you want to put the calm. You don't have to with the nano needling, but you certainly can. Feel free to contact me if you have any questions, and I hope you found this informative. You should only do microneedling on yourself once a month, and again, the nano needling you can do every other day. And that's it.